A very special place that we're incredibly proud of is Victoria's Peter MacCallum Cancer Centre. As a global leader in cancer research and treatment, their sole purpose is to find better care and potential cures for cancer. Jo?
They just do amazing work, Das, which now includes groundbreaking new treatment for prostate cancer. It's to help men with an advanced form of the disease and is showing some extraordinary results.
Anton, welcome. Thank you for your time today. Can I start by asking, when were you diagnosed with prostate cancer?
I was diagnosed 2012, and I had a PSI test, and it was quite high, and it was very suspicious. And then I had a biopsy done, and it was established that I had a prostate cancer.
So your diagnosis 8 years ago now, and you had several different treatments. Can you briefly just explain what you'd been doing to treat it previously?
One of the treatment that I started in Peter MacCallum Hospital was chemotherapy and docetaxel. And in my case, it did nothing. It absolutely did nothing. It didn't help me at all. Can I ask you, Anton, what was your response when you first heard about this radical treatment? What it does, it goes and sticks onto the prostate cancer cells. And it does it so good. It's not funny. But when you look at why this works, it is amazing. And I do feel much better, much better. Prostate cancer is a sort of disease which burdens you. It becomes sort of, you feel weight on your bones and all that, which is all gone now.
Great news. Have you seen your scans since the treatment, and what do they show?
Yeah, the scans are showing that, they told me volume of disease and the PSI. They seem to have gone down something like over 95% anyway. So, I was amazed. And I think doctors were quite amazed with me as well.
So I'm a nuclear medicine specialist at Peter Mac in Melbourne, and we are using some radioactive substances, both to diagnose and also to treat cancers. And in recent time, I've been focusing my research on improving outcomes for men with prostate cancer.
How would you describe it as being different from previous treatments?
So this is quite a unique form of treatment. It's called theranostics. So the way this works is we give an intravenous injection into a vein of a radioactive substance. It's quite a clever radioactive substance because it binds specifically to prostate cancer. So it travels around the bloodstream, binds to prostate cancer cells wherever they are in the body. And we're using this in men where the prostate cancer has metastasized or spread. That's often to bones or sometimes to lymph nodes. So it travels around the body like a homing device, finds these cancer cells, binds to the cancer cells, is taken up into the cancer cells. We can then put the patients on a PET scanner, which is a special whole body imaging device, and get some extraordinary three-dimensional images. And these show us the tumour spread throughout the whole body, wherever it happens to have gone. And if the uptake is high, it suggests that we can also treat the patients with a similar compound. And to do that, we just change the radioactive label. We use the same compound, but rather than a type of radioactivity that passes out of the body, which the scanner detects, we change to a radioactive substance which travels only a few millimetres but deposits really high amounts of energy to kill the cancer cells. So this is a really targeted form of treatment. It's very different than chemotherapy. We can both visualise what we treat and then treat the cancer wherever it has spread. So it's quite a remarkable form of treatment.
How have the trials gone so far?
Yeah, so we've been doing this treatment at Peter Mac for 5 years, and when we started doing this treatment, we were taking men who had really progressed after all forms of standard therapies, chemotherapy, other sorts of hormonal therapies, really when the oncologists had nothing left to offer, and we were treating them with this novel treatment and seeing really some extraordinary results, even in the men who had progressed after 3, 4, sometimes 5 lines of standard therapies.
Short time ago, we spoke to Anton, one of your patients who appears to be doing incredibly well. Can you tell us about his case?
Yeah, so Anton is a patient who had progressed after a type of chemotherapy called docetaxel, and he'd also had a hormone treatment and was reaching the end of the line. And traditionally may have just gone off to palliative care and had a symptom relief in his last few months of life, but he found his way to this clinical trial where we've given him the radioactive treatment, lutetium PSMA, in his case combined with an immunotherapy treatment as well. And his cancer had spread to bones, and on his scans we can see that really all the bones in his body was riddled with prostate cancer spread by the time he had come for this treatment, and that was causing pain, but also just fatigue and general decrease in quality of life. And what we saw with the treatment was really a major quick reduction in the tumour burden, and he had 6 cycles of this treatment and is now, really back to normal, didn't have much side effects from the treatment as a bonus, and is doing fantastic. He feels like he's, having a second life.
September is International Prostate Awareness Month, which aims to raise awareness and funds to help fight the disease. Some city landmarks will be lit up blue across the country, and everyone's encouraged to wear a blue ribbon to support the cause.
You can also light up your own home in blue for the cause, or even a local landmark. Just head to the Prostate Cancer Foundation website to find out more.
From lighting up Australia to brightening up your nails, and blue is a bit of a favourite of mine, here's the latest beauty buzz on how to get salon style at home.
I don't know about you guys, but I think there's something a little bit empowering about having a beautiful